It is the final day of the 15th BRICS Summit, and on the sidelines is a very critical discussion, a leadership dialogue looking at pandemic preparedness. Now, joining us to discuss this further is Dr. Jean Kaseya, who is the Director General for Africa CDC. Doctor, thank you for making time for us.
Thank you, Zandile, for having me.
So it's a very critical discussion that's about to take place here on the sidelines of the BRICS Summit. And I'm really interested to find out what are some of the key factors that can be set up following these deliberations this week on assisting African countries on building more resilient health systems, particularly looking at the sobering lessons from the COVID-19 pandemic.
Thank you, Zandile. You know, when I took time to discuss and to listen from other colleagues who are attending the BRICS meeting, I said we're right as Africa CDC to develop this long-term strategy that we are calling the new public health order. And this new public health order is really fitting what we think that we need to address in Africa to have more resilient health systems. And pillars of this new public health order, we are thinking mostly about human resources, how to develop the workforce, health workforce in Africa. As you must know, today we have just 4 or 5 countries that can, with sufficient health human resources, respond to a major outbreak. The second pillar is the local manufacturing. You know, from COVID, we learned that we don't have access to some of these medical countermeasures. This is where we are pushing the agenda of manufacturing our own vaccines, manufacturing our own medicines and our diagnostics, also and other consumables. We think also about how to strengthen the national and the regional coordination mechanism, because this is one of the key lessons from COVID. We can't continue to fight only by considering individual countries. We need to come up with a regional approach. Then strengthening the National Public Health Institute at country level and strengthening the regional mechanism will help us also to fight. You know, now we have cholera affecting 15 countries. We can't just go with individual approach. We need to come up with a regional approach. We also have the domestic funding that is critical at this moment, because it's good to request support from others, but it's valuable to start also to provide funding from our government, our national budget to the health system. You know, all of that are some of the pillars that we are promoting to build resilient health systems in Africa. And when we are talking about it, this is also what led Africa CDC to develop the new strategic plan 2023-2027 that is promoting all of these pillars and more than that. And the dialogue that we had with other BRICS countries, some of them, they say we have to learn from Africa and Africa CDC on how we are doing that.
And speaking about learning from one another, through collaborations, what are some of the measures that have been set up to assist and guide the BRICS member states on how to efficiently use the data-driven and the evidence-based research that can be then translated into policies that bring better public health solutions at a global level?
You know, when we are talking about BRICS, we are talking about countries that are having a GDP that is higher than some other grouping countries that we know. We are talking about countries that have around, with some countries that are coming, around 50% of the global population in the world. It means we are talking about countries who need to collaborate to make impact in public health in the world. And this collaboration will be through the framework that we are putting in place. You know, now Africa CDC is working with BRICS countries to put in place the framework that can guide our collaboration. This framework, one of the critical points will be the digital agenda, digital transformation, how we can really use data, collect, use data to inform all decisions that we are making. we cannot afford to miss any kind of outbreak just because we didn't have information. I think this framework is the way to coordinate our effort as BRICS collaborating with African countries.
And before I let you go, Doc, the announcement that we just heard from the President of South Africa, Egypt and Ethiopia joining the BRICS member states, how does this speak to strengthening international health cooperation, sharing of experiences to achieve the UN SDG goals and universal health coverage?
I'm the happiest person today. I'm the happiest person because, and I said that to President Ramaphosa, I will repeat it to him this afternoon when I will meet him, that first, inviting almost all leaders, African leaders, to join this meeting, it's creating a momentum around BRICS. Second, having two countries of more than 100 million people joining BRICS, it's bringing the total population of BRICS around 50%, as I was saying. You know, Ethiopia and Egypt have more than 120 million people, each country. It means we are bringing what we call the high-impact countries to drive the agenda. Having South Africa, Egypt, Ethiopia, and more to come, I hope, will really help to sit with other partners and to be driven by our own priorities, not by their priorities, to say what we are bringing. And now we have 3 countries, what we call BRICS. I don't know if the name will change, but it's still BRICS. We have 3 African countries sitting there, very important countries, and these countries representing different regions of Africa. It means bringing some values of Africa to share with other BRICS members. I think we are also promoting another idea. How can we set up what we call the BRICS PPPR Fund? You know, BRICS Pandemic Preparedness, Prevention and Response Fund. We have a new development bank led by Dilma Rousseff with $100 billion. We know that BRICS countries are also affected by outbreaks, and all of us were affected by COVID. We know the disruption that COVID had to bring to our economies. To prevent the next pandemic, we need to start. We need to have this BRICS PPPR fund. We'll build on that. Then we can call other partners to join us and to see how to better support our countries.
Thank you so much.
Thank you.
Pandemic preparedness at the center of the final day of the 15th BRICS Summit. It's back to you in studio. I'm Zandile Myeza for SABC News.